Hello and welcome to StratNews Global. I'm Surya Gangadharan. I have with me today a very special guest, Mr. Vincenzo de Luca. He is Italy's ambassador to India. And as you're all aware, we've seen a lot of help rendered by a lot of European countries, including Italy, especially in terms of providing oxygen tankers and a whole lot of other materials. And Ambassador Luca, welcome. Thank you for appearing on our show. So may I begin with the first question? How does help of this kind get underway? Does our External Affairs Ministry get in touch with your ministry? Does it happen at the mission level? How does this work?
Yes, thank you so much for this question. The Italian government has been very fast in responding to an Indian government request to a supply of oxygen, machine for oxygen, machinery, and also some other materials. We have been able to provide an oxygen production machine in a very fast way. We have delivered the machine yesterday at the hospital in Greater Noida, and the machine is already working after 48 hours since its arrival in Delhi airport. This is an important signal of the solidarity and reaction from the Italian government to the pandemic here in India. This is very important message because pandemic is a global issue that needs global response and global solidarity. That's the policy of our government and the policy of the Indian government. Work together to fight against pandemic, against COVID-19.
Ambassador, did you receive a specific request for oxygen tanks from the Indian government?
Yes, we received this request. We have also working with our companies to provide some supply. We have a company here in India called Sol that produce oxygen in Tamil Nadu. They have increased the production here in India to tackle this emergency, also providing some container and other materials, and also providing more oxygen production.
Mm-hmm. So is there any material coming from Italy?
There is this machine, there are some ventilators, and we are trying to collect other materials that is useful in this period here in India.
Mm-hmm. Ambassador, I just want to understand the process involved. Does the Indian Ministry of External Affairs get in touch with your embassy? How does this work? With a specific request list? How does it work?
For us, the role of the Ministry of External Affairs and of the Embassy of India to Italy has been vital for organizing this aid. We have organized our supply based on a formal request coming from the Indian Embassy in Rome, and we have worked very closely with the Ministry of External Affairs here in Delhi to organize the delivery and to organize also the operation in the hospital. I've been very, very glad to tell you and the public here in India that this cooperation has been very effective and very fast.
Ambassador, I presume this is bilateral. Is there something broader that you're aware of with the EU?
This cooperation is in the framework of EU-India cooperation, because we have a mechanism of civil protection in Europe that collect all the aid from each member state. So this supply from Italy is in the framework of European Union. Of course, we have organized all of this in Italy, and here we have received this delivery at the airport together with my friend, colleague, the EU head of delegation in Delhi.
Mm-hmm. Ambassador, do you see any parallels between what you're seeing in India today in terms of the pandemic and what you witnessed and experienced in Italy last year?
Yes, Italy was the first country affected by COVID after China, and in Europe was the first one. So we suffered the start of this pandemic in Italy last February, March 2020, and we learned some lessons from our experience. We adopted the lockdown very soon The same was adopted also in India last year. And I think the lockdown at that stage was very important to contain the spread of the infection and also to facilitate the organization of a better hospitalization and materials to help patients to be assisted in these very difficult circumstances. The same was here in India during the lockdown. Also in Italy, we suffered a second wave in October, November. At the same, we had some problem in facing the emergency. Now we are in a better situation, adopting restrictive measure. The same is here now in India, and we hope that also in India we can now solve this emergency and try to reduce the infection.
Are you aware of any contact between the medical establishments of both countries? Are they trying to?
We have a lot of collaboration between Italian hospital and Indian hospital since the beginning of this pandemic. We had also a webinar sharing experience on how to treat COVID between the principal advisor of our Minister of Health, Walter Ricciardi, and the coordinator at the Ministry of Health here in India, Agarwal. It was a very long discussion on how to share experience, how to work together to have a good lesson from what we have done and what we can do in the coming months and years. Because, of course, we have to be prepared also to face further waves and further pandemics in the future, unfortunately.
And are you also facing this problem of mutant strains of the virus?
Yes, we had also in Italy the so-called UK mutant last October, November, and the infection was very fast also due to this new mutant, new variant. And the same, I think, is also here in India. We have to be very careful because this mutant, this variant can take place also in other areas. The main task for all the international community is to speed up the process of vaccination all over the world, because the world is not safe, all the world is safe.
And which is the vaccine being used in your country?
In Italy, we use several vaccines. First Pfizer and Moderna, then AstraZeneca, and now also Johnson & Johnson. In next October, November, we will have also an Italian vaccine probably available, that is Reitera. So we are trying to use all the vaccine available. Of course, there are different characteristics of this vaccine. Some vaccine can be given only with one dose, like Johnson & Johnson, other with 2 doses. But we have experienced that even the first dose is very important for having a first cover against the infection.
And your coronavirus cases are dropping?
Now are dropping after an increase in the last few months. And now we have some first limited reopening in Italy for restaurant and for hotel. And we are preparing for the tourist season in summer with a green certificate for the European tourists coming to Italy.
And what would you, what are the kind of conclusions you draw from your experience in Italy that could be applicable in India?
It's very important monitoring the situation every day, to have test in a large part of the population. And now it's very important to extend the vaccination to all the categories. We start with the most sensible categories, over 80, over 70, over 60. Now we're trying to have all the population vaccinated, at least over 18 years old.
And people are generally cooperative?
People are doing the vaccination, and I think there is an increasing awareness of the importance of vaccination. At the beginning, there was some reluctance in part of the population to be vaccinated, but after a period now, there is an increasing awareness about the importance to be vaccinated.
Ambassador, there are concerns in India that a third wave is on the way. And is this, how many waves has Italy experienced so far?
We can be better protected for a further wave if we increase the number of vaccination and increase the number of tests. because we have to know how the infection is spreading and how to contain it. To understand how the infection is spreading, it's important to test the most part of the population, and to contain the infection is important to increase the number of vaccination. These are the two main elements in Italy, I think all over the world. Now we have an experience not only in Italy, in Europe, in US, in India, all over. It's important also to coordinate our efforts and to have solidarity. When a country, a region needs some material like oxygen or other medical remedies, we have to be able to provide this supply. This is a lesson also for the future, I think.
Last question, Ambassador. The US has indicated that it is willing to go for an IP waiver on vaccine supplies to India and to other countries. Is this something the EU is comfortable with? What is the situation in your country?
This point will be discussed at the next summit in Oporto tomorrow and Saturday. Of course, the problem of giving access to vaccination is very, very important. And we have to find the best and the most effective way to really give this access, increase the production, not only in Europe and the United States, but for example, in India and in other countries. And this is the best response to even if we have a further wave, because maybe vaccination will be repeated also in the coming years. We have to see which will be the evolution of the variant of this infection, and to be able also to adapt vaccination in the coming period. So it's a very important effort that we have to share at the level of the international community. We will host next 19th of May in Italy an important health summit organized by Italy as president of G20 together with the European Commission. This will be an important occasion to share experience and also to define a common commitment all over the world to tackle this pandemic.
So are you positive about IPR waiver from the EU?
We will see. Of course, this is an important effort from the United States. We welcome this effort from the United States. We will see which will be the impact. And in any way, Italy and Europe was the first continent in the world to support the initiative for having vaccine all over the world, also investing money on this. So the political commitment is there. Now we have to discuss also with the United States in the framework of WTO and all other organizations how to make the vaccine available. The best way, the most effective way, together with the Indian government that is very much committed on this, I know.
Good to hear that, Ambassador. It's a pleasure talking to you, sir, and looking forward to greater cooperation between India and Italy. Thank you so very much.
Thank you. We are ready to do that. We are in the spirit of solidarity and friendship, very close friendship with the Indian government and with the Indian people. We are with India together.
Great to hear that, Ambassador. Thank you.
Thank you.